Hi Sal, welcome to Health Coaching TV. So good to have you here today. How are you going?
I'm good, thanks, Kate.
Good. So Sal, we'll go through, just have a chat about your wisdom, your knowledge, the passions that you have in terms of aging and kids' health. And I'll just do a little intro so people have a bit of background on you. So
hmm
you graduated medicine from UWA, moved to Queensland, where you developed your unique way of educating and encouraging people to take responsibility for their health and well-being. You like to focus on the individual, not the symptom, and you've been doing things differently with hormones since Dr. John Lee, who's very highly regarded in that field, found out about natural progesterone. You moved back to WA in 2006 and currently studying with the Australasian Academy of Anti-Aging Medicine. And anti-aging medicine clearly defines a multidisciplinary regime with a number of treatment protocols to provide a more holistic approach to the ultimate in preventative medicine.
hmm
You're passionate about educating future doctors to think bigger, and you've been part of their team teaching at UWA Medicine School for how long, Sal?
This is my third year.
Third year.
Mm.
So making a real difference in terms of the profession itself. You're currently working in general practice at East Fremantle Medical Centre, where you spend a lot of the time coaching mothers to prioritise themselves. And how important is that, and something that we just don't do?
I think, like a lot of the time, a lot of the people that I see, everybody's got something to do, and I think it's difficult, even in as much as enlightened women are, and women aren't, are in different roles than they have been in the past. I think women need to be acknowledged, particularly mothers,
Yes,
for the 24-hour job that they do. And I will often say to a woman, "You're doing a great job."
I also think I do that a lot in terms of my work, supporting mums and recognising them and trying to build a bit more community. It can be quite a lonely place,
Yeah.
especially with young children. And I also think, there's not a lot of preparation. Women are guided and supported into the corporate world or to create a profession, but that profession doesn't include motherhood.
Well, I often say to mums and dads when they come in with a new baby, I say, "Look, the baby didn't come with a manual, you didn't come with a manual, and nor did your husband. And people are going to tell you all kinds of things, and you just need to practice. Oh, this is a secret coming out. You just need to practice going, and then working out what works for you.
Yeah,
And that's what I like about being able to refer to you and our Happy Children program, because women need, or everybody needs to be resourceful. So to take the pressure off thinking I have to know everything, which I think the internet, or as I call it, the Wizard of Oz, because it really is just the Wizard of Oz, where you put something in and an answer comes out. I think there's this onus, or people feel this responsibility or having to know everything, and not only just to have the answer but to understand it. And I don't think, clinical acumen doesn't come with Dr. Google.
no.
So in the context of women and mothering and parenting, I think it has to be okay for women to say, I need some resources, who can help me? And
Yeah.
that's what I love about referring people to you, because I just go, "God, it's okay."
Yeah, thanks. And I think, I guess that's some feedback that I get. It is confusing to know just what to do and to have the time to do it, because there's so much else to learn as well. And I know, you're a mum, your daughter's older now, Sal, but I think generally, thinking holistically, you have a great approach in terms of health, not just food, but more holistically. If someone comes to you, you're not necessarily going to prescribe the latest medication, but perhaps more rest or a walk or something like that. So, in terms of even with your own experience, I mean, what have you found is most important for kids' health and for general health for mothers?
I want to tell you a funny story about that, because you have to be mindful of who you're talking to when you offer advice. I had a lady come in a number of years ago, and she wasn't my patient, and she had a cold, and so my normal prescription would be rest and zinc, go to the beach, put your feet in the water kind of thing. lots of water, whatever. Anyway, she wrote a letter of complaint to the surgery. She said I wasn't better the next day, and she told me to take a walk at the beach. Well, I didn't think that was appropriate since she'd given me a medical certificate for work. And it was kind of like, okay, right, well, yeah. And that's when I decided I wouldn't routinely see people that weren't my patient, because I didn't want to coach anybody else up to where my patients are at. So we have to be mindful when we're helping people of what they really want. So I'm much better at asking that.
Yeah.
It's interesting thinking about being a mum, because, you know, my daughter didn't come with a manual either. And I remember I was a hippie in the rainforest, you know, I breastfed for years. But early on, you know, the whole external stuff, it can be quite seductive. And I remember watching my daughter just in a nappy walking through the orchard, and she had a popper, and it was a popper with juice in it, and it was 100% juice. But I remember watching her, she was just started walking kind of thing, and I'm thinking, oh, no, you know what, I just don't think that's for me, you know, and that was the first and only time I ever bought poppers.
Poppers as in, sorry, Estelle, poppers as in the...
Oh, the little things of juice.
Juice box.
Yeah. So she's always, you know, I've always made a lunch, and she's vegetarian because I used to be. So changing, you know, when she left school a few years ago, and so I wasn't cooking for her and she wasn't home as much, it was dangerous for me in hindsight, because I fell into being a tea and toast mum. So that's why it's important for us to be mindful of how we're nourishing ourselves as well as the children, because they both have to be on track. And it's not uncommon when I'm talking to mums that they have made particular effort with the children when that's their interest, but they've probably not looked after themselves as well. So
absolutely, yes. And it's hard for a mum to actually do the best job she can, I think, with kids if she's not 100% herself, or not looking after herself, giving herself time. Whether it's to, you know, rest, spend time with friends, whatever it might be.
Have a massage. And I think that, you know, that's one, coming back to what you provide, is strategies and support to take the pressure off and make the kid thing easier, and to get them, you know, like I know we're talking about children mostly today, but, you know, one of my clients, I actually thought she ate all right, you know, and this has been a challenge for me to think that someone isn't eating properly anyway. I'm always a bit gobsmacked when I find out for some way. Anyway, this woman I also look after her daughter, and the daughter tells me that she's gained weight while she's been living with her mum, because her mum's frying everything. Yeah. And I think she thinks the reason why mum's doing it is because she's on cholesterol medication. Yeah. I didn't know the woman was doing this. So since I've sent it to you, she's been eating quite differently, and the daughter's been really happy as well.
Yeah. I know who you're talking about, and most people think that they are doing the right thing, and it's only because that's what they know, and not until they know better that you know, they can make that real change and take their health up a level. I think, and I'm sure you agree with this, Sal, like the food is important, and it does make a great difference in terms of how we feel, how we think, but certainly the holistic stuff together with it, you know, just amplifies it.
I was talking at a Seasons of Being Women's Health Day in Buderim in February, and a gorgeous bunch of women, all scored really high on the antioxidant scanner, so really good levels of antioxidants coming into their life. And I talked about how nutrition, good food is not negotiable. You know, it's really important. So whatever you're having, have the best quality that you can, whether you grow some simple stuff in your garden that's easy but takes a bit off the shopping list. Yeah. And you're better off to have a little bit of something good than have a bulk amount of something that's not as good, you know?
Absolutely. Well, we were talking earlier before we started the call about laying that foundation of health, like that bedrock of health, especially in kids. It can change, and it works at any age. It just takes longer the older you get in terms of making and changing choices. But certainly, Sal, I don't know, do you see that within your work? Kids who have maybe had better nutrition and the difference that it makes in terms of long-term health?
I think, let me think. I don't see a lot of kids, and because of my interests, I see a lot of kids whose parents are interested in making better choices, and they often come as parents who are making better choices for themselves long term, so are in better shape. But definitely, kids that eat better are less at the doctor, and they are more robust. There's no doubt in my mind that having better fuel
Yeah.
makes a big difference to their health. Now and again, I get kids that come in and they're eating from a packet of biscuits or something, and it's like, oh, like that could be a better option. But most of the time when they come in, they're not too unwell, and they've usually got a picnic of stuff that I wouldn't mind having a bit of.
Yeah.
Sometimes they bring in a little gluten-free snack for me.
Oh, great.
I once said to a patient, "Oh, did you bring in an adult?" I said, "Did you bring in a gluten-free afternoon snack for me?" And they looked at me and I said, "Oh, didn't you get the message when you made your appointment after 2 o'clock? You're supposed to bring me a gluten-free snack."
Yeah, totally. So just on that, Sal, what are your kind of key, if you had top 3 or 4 or 5 key things in terms of food and adding in good choices, what would be your priorities?
I think keep it simple,
Yeah.
make it fun, and make it different. So I think it's important. We all get bored or disinterested, so it's good to be able to either have a favourite cookbook, or sometimes I like to think of a food, a bit of, a surprise chef. So think of a food in the fridge, and mostly in a house it's going to be broccoli. And so then I'll type in the chef that I want, broccoli, and see what recipes come up. So I love Jamie Oliver. So if I put in Jamie Oliver and broccoli and see what recipes come up.
Great.
Because it's so easy to get bored and get lazy.
I love that. Great idea.
Yeah. So I do that, play around with that.
Yeah.
And then I like to buy different things each week at the shop so that I've got different ideas of things. So I don't always buy the same thing. However, I do always have some form of broccoli, whether it's broccolini or broccoli, because my daughter thinks that there's no food if there's no broccoli in the fridge.
Yeah, good. You've got her well trained.
There's no food in the house.
Yeah.
Hello?
Yeah.
No, it's no broccoli. That's what she really means is there's no broccoli.
Sal, there's a bit of an aeroplane going over.
Yeah.
Tell us a little bit about epigenetics. I know that's an interest of yours, and it has been around for a little while, but it is fascinating, and I love the epigenetics, because to me it means that we have a lot more power and control over our health than we think we are destined for. So can you maybe tell us a little bit about that just quickly before we finish up?
Well, epigenetics is about, most of us have very similar gene pool, and it's only very few gene mutations that makes me different from you. But epigenetics is about influencing how your genes express by changing the environment, and it's as simple as thinking about a set of twins. So they might look very similar for a certain period of time, but definitely by the time they're 40, unless they're living in the same situation or making exactly the same life choices, they'll start to look different. And so that's epigenetics, which is the influence of the environment, whether it's nutritional, stress, or otherwise, influencing how those genes express themselves. So the things that I've been thinking about lately is, we talk about having a 3-month period preconception to get into good shape. And if you conceive a girl, the most impact you're going to have on that female's future children is during pregnancy, because that's when her gametes or eggs are developed.
Yes.
So that 3 months prior to conception is so important. Yeah. And then for boys, it's between 9 and 11 when they make their gametes or spermatozoa. Okay, when they're 9 to 11 years old, is when you influence their children. So that's where the fathering project coming out of UWA is really important, where we teach fathers how to be better fathers,
Great.
Because they didn't come with a manual either. And there's a lot of men have lost their community and or their parents didn't know from what life circumstances or whatever reason.
Yeah.
So the whole fathering thing is really important then as much as mothering is in other areas.
So you fathering at that age range of 9 to 11?
Yeah, it's critical. Of course, you want to. I'll tell you another time about it. But it's run through UWA,
Yes.
and it's a brilliant program. So that it's kind of like the men's project, but for younger men that are parents, you know, so that they have they can be better role models for their boys and stop the ridiculous behaviour.
Yes.
You know?
Look, and I think, you know, you just hit spot on as well. So in terms of role modelling, you know, I used to think, you know, love, discipline, respect and things for kids, but really one of the best things that we can do for our kids is role modelling.
Yeah, and that's, you know, when the other day I said to a parent that was making ridiculous choices, I said, no, she wasn't making ridiculous choices. I was talking to her about fat loss and a program that I'm currently working in with that's epigenetics based. And she said, you know, I get really busy. She's not a parent yet, but she'd like to be in the future. I get really busy, you know, sometimes it's easy to have this pre-packaged meal thing and I just pop it in the microwave. And I said to her, are you going to have kids in the future? And she said, yes, I'd like to. And I said, well, what are you going to role model?
Yeah.
And you've got to think that in a values hierarchy, convenience ought not to be at the top.
No. But then again, so I think it goes back to, you know, education. Like people don't even think twice. They're busy, you know, working, just doing whatever the quickest thing is. But it's that convenience culture that's got us into so much trouble in the first place, where we are today in terms of health and illness.
Yeah.
Really, because we're taking shortcuts and with our health as well.
And, you know, it's just the thing that you and I are both very passionate about is that whole focus of creating education and understanding for people in their health. After the women's health thing in Budrum, whenever I go away, I usually come back and think, what's the meaning of life? You know, what am I doing? What am I going to do now? Kind of thing. Oh, my God, little chicken little. And on the Monday, I thought, I'll ring my friend Christine. She's a Reiki master. She told me about some clients she'd worked with. I've done some Reiki in person with her and it was lovely. And she does it over Skype. And I thought, I'll do that. She'll make me all better. Yeah. And then I thought, she'll say, you're meditating every day. And I went, okay, right. Yeah. So that was the end of February. And so I've been meditating daily since then.
Yes.
And now I suggest to all of my clients that I want to talk to about that meditation is up there with good food. So I now think that meditating on a regular basis is also not negotiable as well. So that's been over 7 weeks for me.
Oh, fantastic, Sal. What have you noticed?
It's every time I do it, it's easier to stop all the noise. I don't struggle with the tourist thoughts that come in. I let them go out, and even prior to meditating, I was good at being calm on the outside, but I'm even a bit more clearer.
Yeah. It's that monkey mind helps to tame it.
Well, somebody said, you know, thoughts are like tourists; they come and go. So I thought, that's curious. My yoga teacher back on the Sunshine Coast said that your mind's like a puppy dog and it wanders off and just bring it back. So I like the whole, you know, just gently bring it back.
It is training, isn't it? I mean, that's what the brain's amazing, but it is training the mind. And
it's the same with food, you know. So sometimes, you know, particularly in weight, people are ready to throw away a strategy because they made one choice that they're not happy with. So it's not that you have to be on track or do it right all the time, but you need to be mindful of what matters most. And, you know, if a friend of mine is very keen on not having any sugar at all, and one of my patients yesterday pointed to the apple that was my afternoon snack up the bench, and she goes, that's got sugar in it. And I said, for me, it's not about the fructose in it. It's about all the other things that rank higher in that. So it's an afternoon snack. It's metabolism. It's raw. It's got a whole lot of good stuff, and that sugar's not going to break, you know.
It's a whole food. It's got all the cofactors to...
Yeah. So for me, it's not about the fructose in it. It's so much more than that. So, which I think the important thing is to be open, because there's so many different boxes that we're offered to jump into, whether it's, oh, we should be eating paleo, we should be eating raw, should be no sugar, you know, should be full fat. And it's like, find what resonates with you, play with it, and then make it work for you.
Absolutely. You know? I totally agree, Sal. And, you know, enjoying food, not being hung up or worried about it, or have fear around it.
Yeah.
Yeah, which can do more damage than the food itself. Yeah. So you love, your passion also is anti-aging. So can you tell us a little bit about your work in that field?
It comes back down to a good foundation. So it needs to be inside out. And so good food is a good start. And then I also like a bit of science on the outside and the inside that's epigenetically based. But if you haven't got the good food and the happy thoughts and the nice people around you and some regular exercise and a bit of yoga or something that you like to do, then you'll just be pushing it, you know. You just do nice things most of the time.
Yeah. It can just take 5 minutes, you know, as you say, with your meditation or anything, just to still the mind or to go outside and appreciate being in the present moment. You know, just
in a garden.
Yeah. Oh no, well, it's a happy place.
Yeah.
Whatever takes you to your happy place.
And also, I think it's good to evaluate now and again. I remember a psychologist I did a workshop with a long time ago. Yeah. She said that every 3 months she evaluated where she was at in her life, and she set up a strategy so that once a month, I think she had a 4-day weekend, so she took Monday and Friday off.
Yeah.
And every 3 months she took a week off or something like that, just so she had the strategy there so that she knew what she needed to do in order to do what she wanted to create in the middle ground. So it's interesting. For a long time I don't think, for me, work-life balance doesn't resonate, because I understand that in order to create anything amazing, you're going to be out of balance for a period of time.
Yes.
But I think in order to do that, you just need to back yourself up with some strategies so that you can be, you know, focused in a particular thing, and then you reassess. So you don't just go hell for leather on something without having a strategy for, you know, maintaining your health.
Yeah, definitely.
The health of yourself or the health of relationships or things around you. So you can be really committed to a project and put a whole heap into it, but you also need to have the strategies to support you and able to do that. And, you know, the number one thing is food. And time out, Sal. You know, like her strategy was the long weekend and the week off. And, you know, that's total time to relax, declutter, but also to think ahead, you know, to give your mind space to do that. And you know what? The main person that we need to get permission to do that is ourselves. So I don't know about you, but there is a particular thing that, did I do enough today? And I have meditated actually on the whole concept of what is enough.
Yes.
Really, by the time you've done a little bit in the morning, isn't that enough?
It's enough. It's enough.
Yeah, so smile at someone.
It's whatever, and every day is different, isn't it? Oh, no, totally. So in terms of anti-aging, are there any specific foods that you would recommend to add into the diet?
I think colour on the palate and be adventurous. I love my Thermomix, and so when you go to do a cooking class, somebody will use something differently. Like kale. Kale, I think, is a beautiful thing, but some people are nervous about cooking it because it's so green, you know. It's kind of like, is it like spinach? Well, I just roughly chop it in the Thermomix with some usually beetroot, purple onion, broccoli, maybe a carrot, and garlic, and then put that in the fridge and have that all ready to go, so I can mix it with some quinoa and some coconut oil.
Beautiful.
And just heat that through and then put some eggs on top, or chicken or halloumi or tofu.
Beautiful.
And you're just getting all those, you know, that good bit of colour without a whole lot of effort. And so you've got to have strategies to make things easier.
It's also experimenting with these new ideas, I think, Sal, and finding what works, as you said. And with time, it just becomes a way of life. You know, these choices is just part of what you do.
And that's why linking up with you and doing a series of classes or a course gives you the opportunity to learn some new stuff, but then to go back and revisit it and learn new things or different ways of looking at the same thing, you know?
Absolutely. And understanding why we're making the choices. You know, putting a little bit of emphasis around that too. But, you know, also just talking about my programs, I have to say, I think the community of people and linking up with like-minded people is so important.
Yeah.
Because sometimes it can be hard. You know, you're on this journey, and if you don't have people around you who are making similar choices, it's hard. So, you know, I'm very conscious about that and creating that as well.
It gives confidence to the individual that she's on the right track, because if they come and visit you, they're interested in or open to finding out how they can do things differently. And sometimes, you know, one of the things that I became aware of in the last year is that now and again I think, how come if people know all this, they're not doing it? And I came across a book on leadership, and it clarified that, you know, at times you'll be a mentor and other times you'll be a coach.
Yes.
So you provide both to families, where you're giving them new information, but also giving them an opportunity to revisit what they already know and learn how to integrate it in what they do.
Absolutely, Sal. And you know what? I think most of this stuff we know, but it is tapping back into that ancestral and that inner wisdom. You know, with food and lifestyle, you know, it's our ancestors knew, really. We've just kind of lost track of it a bit. Yeah.
Have fun with it.
So, yeah, exactly. Hey, Sal, I'm conscious of the time. Is there anything else that you'd like to share? Any other words of wisdom with us before we sign off?
Oh, we're here. Well, I think I'm here for a good time. And I was saying to someone today, the lady at the dry cleaner.
Yeah.
I said, if I'd known you were here, I would have bought you one of these dark-covered chocolate mint energy balls. They're just amazing. She goes, dark chocolate? She goes, isn't chocolate, you know, it's good for your gut? And she started talking about her gut. I said, who have you been talking to? I would never think about gut when I talk about chocolate. She goes, yeah, but sugar makes you go. And I'm like, can we step away from that for a minute and think polyphenols? You know, let's think all this stuff in the chocolate. She goes, okay, I'm going to start eating dark chocolate as a medicinal thing. I said, yeah. And she goes, but won't I get fat? And I said, you're just having one square. Yeah. She goes, no, I won't. I said, look, how can you have everything if you have more than one square? I said, I want the glass of red wine, the cup of tea, and the chocolate. Yeah. And in order to have everything, I need to have a little bit. And that's what matters to me, you know. So that's what it's about.
Absolutely.
Create your own picnic, build yourself a team of people around you that will give you the answers that you need and will be there to support you and shine your light.
Oh, Sal, I love that. Perfect. I just love that. I'm going to tweet. Really, honestly, Sal, so nice. And thanks so much for sharing. And, you know, your energy, you have a beautiful disposition, and I think your patients benefit just from being in your company more than, you know, anything else. And it's true. It's, you know, you're a gift. So thank you very much for sharing it with us today.
Thank you, Kate. I think you're looking in the mirror when you talk like that.
Oh, no. Thank you very much, Sal. Okay, bye.
Bye-bye.